And so currently we have 72 patients who are hospitalized that are being treated for COVID-19. As many of you will know, after having watched our town halls the past few weeks, that number is down. We were up in the 90s really for the past several weeks. Now we're down at 72 currently. The trend line there, you can see remember the yellow line on the graph is our number of patients hospitalized on any day. You can see how that has dropped over the course of the past week. The orange line is the number of patients hospitalized in the state of Virginia. Just a few weeks ago, that was up over 2,800 patients in the state in the hospitals for COVID-19. Now that's in just over 2,400 patients in the state. So the trend lines there are the dotted line. That's a 14-day moving average. And you can see if you look at those last couple of dots on those dotted lines up top there, they're trending downward, right? And so that is a good sign. Our 14-day moving averages are trending in a downward direction. And so this all looks very good. We're very pleased with how this is currently trending. It certainly looks like we are again reaching a point where we are flattening the curve, which is what we've been talking with everybody about for the past several weeks. Now, we know just a day or two doesn't make a complete trend, and this could change. And we take it a day at a time, and we, every day we come in and we deal with what we're dealing with. But certainly does look like we have a little bit of a reprieve here in the past week, and we're thankful for that. And so it's probably multifactorial. I know everybody who tunes into the town halls has been helping us spread the word about stay at home if at all possible, wear masks if you do need to go out, limit your time in indoor environments around others, right? Wear masks indoors and outdoors, social distance at all times with other individuals, and use exceptional hand hygiene. And so a combination of all those things is helping us flatten that curve again. And we think that is great news. And so I'm happy to report to everybody tuning in today that, hey, there's just a tad less pressure on our health system today than there was last week. And that is good news.
So Dr. McDermott, we're getting some questions. You talked early on about our data, showed that some of the numbers are starting to go down a little bit, which is incredibly encouraging. Are we close to a return to normal? Are we close to schools going back? Are we close to going back to restaurants? Are we close to coming back to the office and working together in the same environment again? Is it too soon to say, or where are we with this?
Well, it's certainly too soon to say. I mean, we have over 70 individuals hospitalized in our hospital right now who are battling COVID-19. We didn't have anything near that number in the spring. The prevalence is still very high. The positivity rate is still very high in our region. They are trending down, and that's good news. It's better than them continuing to trend up. But we are nowhere near there's still a firefighter out there. There's flames. And so it's not like we're looking at the embers and the small amount of smoke left from the the forest fire. We're still on fire out there. And so people still need to follow all the tactics we need to do at this point in time to lower the prevalence and lower the transmissibility of coronavirus in our community. So I understand everybody wants to go back to normal. It's not going to happen magically in a matter of an hour or a minute. It's going to happen gradually over an amount of time. There's a lot of good things going on right now. We're excited to have these vaccines. They play an important role in us getting our path back to normalcy, right? But it's going to take time. It's a journey. It's not going to happen in just a second or an instant. And certainly I hope nobody gets the impression from the data that I showed today, which is still very dire data. We have over 70 individuals hospitalized here battling COVID. That is nowhere near normal.